Hi, I'm Jacob Reider. I'm CEO of Alliance for Better Health, and I'm here to talk about a couple of the initiatives that we're going to launch here with Catalyst. Alliance for Better Health is an independent provider association. We work together with community-based organizations and clinicians to improve the health of the people in the underserved communities in Albany's capital region. We do that by empowering the community-based organizations, by connecting them together with information technology that enables the community-based organizations and the clinicians to work together to understand social determinants of health and the needs that the individuals in our community have in that domain, and then connect folks to either services that address those needs in the social domain or in the behavioral health domain or the clinical domain. And so it's really an infrastructure that we've put together to meet the needs of the underserved. What we've seen in the context of COVID-19 is that there's an extraordinary gap in health equity in our region, where the folks who are underserved aren't able to get in line for COVID-19 vaccination. And the federal qualified health centers in our region are also struggling with how to reach people in the community and how to schedule these people for both the initial and follow-up vaccines as they've been addressing. So this initiative that we're working on here is to address two needs. One is to manage and maintain a repository, a clinical record, or a record, a vaccine record, whatever you want to call it, so that we can manage the vaccines in the community. So what we need to do is understand, well, look, we used our mobile van and we gave this person who's on the corner of Main Street and 4th Street a vaccine last Tuesday. That means in 3 weeks, if they got the Pfizer vaccine, they need another vaccine. Now, they may or may not be a patient in one of these federally qualified health centers. So we need to be able to track this. We need to be able to upload the data into the state database and know that we need to find that person or find a way to have that person find us again in 3 weeks. So the two needs that we've identified for this initiative are: one, manage the vaccine reporting and make sure that we understand who it is that we gave a shot to and what we need to do next. And problem two is schedule. So a lot of the problem in our community is that, and probably many communities, is that folks are signing up on websites, but we want to catch the folks who don't have the resources to sign up on websites. People who don't have computers or even cell phones, or the patience to hit redial on a county hotline phone number time and time again. And so we want to reach these people. We want to get them a place in line. So the problem to solve number two is a scheduling system that's going to enable us to get somebody a place in line and even to maintain that place in line and send them an email or send them a text message or give them a phone call and say, hey, we know you're still in line and we're getting closer and this is what group you're in, and then when it's time for them to come, to get them a place in line and have them show up. And so those are our two needs: one, track the vaccination; two, scheduling. And of course, we want to commit to implementing these solutions really soon in our community and to have them in production as soon as we possibly can. Obviously, there's the give and take of timing and quality and feasibility. So we want to navigate that, but what's really important is that we meet the needs of these members of our underserved community in the capital region of New York and perhaps elsewhere if we can find a solution that works well. Obviously, we're in the capital of New York State, and we can use the bully pulpit to spread a great solution to other parts of the state and perhaps the country.